County health officials are on high alert tonight. The first case of monkeypox reported here in Riverside County. Health officials worldwide still working to understand what the disease exactly is. Well, Riverside County health officials say tests were conducted on tissue samples from an unidentified man that showed potential for a case. But there will be additional testing by the CDC to confirm whether it actually is monkeypox. Carmela Karcher is live on our satellite center tonight with more. Carmela?
Tim, county health officials said this first probable case was detected in eastern Riverside County, and officials say it came as no surprise since at least 37 cases have been reported in California, the most of any state across the country.
We did receive a report of what sounds like our first probable case of monkeypox.
Monkeypox has made its way into Riverside County. And while health officials were anticipating this to happen, they stress the risk of transmission is very low.
This is very different than, how we've thought about COVID. Monkeypox in general is a self-limited infection. It's very rare that people will have serious complications.
The case was discovered in eastern Riverside County from a man described only as less than 60 years old. Health officials say the man is currently undergoing treatment but does not need to be hospitalized. But Dr. Jeffrey Leung, public health officer in Riverside County, said it doesn't affect any specific age group or population.
In general, we would say that it has more to do with behavior than age. If people are in really close physical contact with lots of other people, especially if they have many partners, they might be at greater risk. The highest likelihood of transmission comes when you have skin-to-skin contact.
According to the CDC, monkeypox can be also transmitted through intimate contact, living in a house and sharing a bed with someone who has the virus, sharing towels or unwashed clothing, and respiratory secretions through prolonged face-to-face interactions. Monkeypox is not spread through casual conversations, walking by someone with monkeypox, and touching items like doorknobs. But because of this potential case, Dr. Leung is asking that the community know what monkeypox looks like and be aware of symptoms.
The things that we're looking for are sort of new rashes or lesions or eruptions on the skin. And sometimes that can be accompanied by fever, fatigue, or swollen lymph nodes. It's not a new virus. It's been around for a long time. Monkeypox is very different than HIV. So we also want people to be aware of that. We have ways to contain it. We don't think that it presents a significant risk to the general public, but we do want people to be aware of it so that if they do have symptoms that may be consistent with it, that they seek care and that they keep the people around them safe.
Dr. Leung said people usually start showing symptoms somewhere between day 1 to 3. Since it is getting warmer and people will be gathering, especially out by the pool, he said there hasn't been any reported cases where people transmitted the virus who shared a pool. Based on the steady rise of cases, health officials say they wouldn't be surprised to see more cases over time. The CDC will have the final say to confirm whether or not the case is authentic. Live in the Satellite Center, Carmela Karcher, NBC Palm Springs, News First.